Hi everyone, this is Anita again with another video. It's all about respiratory acidosis. As I mentioned in my previous video, respiratory acidosis can be diagnosed by doing an ABG. So it shows decreased pH and increased PCO2. The causes of respiratory acidosis: any condition that causes obstruction of the airway or depression of the respiratory system can lead to respiratory acidosis. The main conditions are, the first one is asthma. So what happens in asthma? In asthma, there is some spasms that results from allergens or irritants or even emotions. So this spasm causes the smooth muscles of the bronchioles to constrict. Okay, so due to the constriction, there is ineffective gas exchange. Next one is atelectasis. So in atelectasis, there can be excessive mucus collection, and this leads to the collapse of the alveolar sacs. Okay, there can be some reasons such as infectious process that is going on in the lungs, or it can be due to anesthetic medications also. So the atelectasis also cause ineffective gas exchange. Brain trauma. So in brain trauma, there can be excessive pressure of the on the respiratory center or even the medulla oblongata where it controls the respiration. So that disturbs the respirations too. Next one is bronchiectasis. In bronchiectasis, the bronchi become dilated. It can be due to inflammation, or there can be some destructive changes also. So when the bronchi become dilated, there is weakness in the walls of the bronchi, so it affects the respirations. The next one is bronchitis, that is the inflammation of the airway, inflammation of the bronchi, so that causes the airway obstruction, so that results in inadequate gas exchange. Next one is central nervous system suppressants. Any medications such as sedatives, opioids, or anesthetics can depress the respiratory center, so that leads to hypoventilation. That means it lower the respirations. So carbon dioxide can be retained, so that leads to respiratory acidosis. And then emphysema. In emphysema, there is loss of elasticity of the alveolar sacs. Okay, so due to the loss of elasticity, that restricts the in and out of the flow of air. Okay, so that leads to increased CO2. So the carbon dioxide is retaining inside the lungs. Okay, next one is hyperventilation. Hypoventilation. So same as decreased respiration, so retention of carbon dioxide. Then pneumonia. In pneumonia, there is infectious process in the lungs. Okay, so there is excess mucus production and lung congestion that causes airway obstruction that results in inadequate gas exchange. Pulmonary edema. So in pulmonary edema, there is fluid accumulation in the pulmonary tissue. So there is destruction or disturbance in the diffusion and perfusion. Okay, then the last one is pulmonary emboli. So the emboli can cause constriction of the pulmonary artery, or it obstruct the airway also, so that results in inadequate gas exchange. Okay, so whenever you get a patient who has a condition that causes an obstruction of the airway or that depresses the respiratory system, always monitor them for respiratory acidosis. Okay, all right, next we will go to the clinical manifestations. Okay, so in most of the time there can be some neurological complications or neurological symptoms that you can monitor for. The patient will be drowsy, disoriented. Patient will complain of dizziness or headache, and in severe cases it can cause even coma. Okay, altered mental status, patient will be unresponsive. All these are the neurological symptoms. Okay, the next one is cardiological, cardiovascular. Okay, so there will be decreased blood pressure and some arrhythmia also, especially ventricular fibrillation. So in all acidosis, including the respiratory and metabolic acidosis, potassium will be high because of the exchange. Okay, the when hydrogen ions come out, the potassium ion goes in. So when the hydrogen ions goes to the extracellular hydrogen ion content increases in acidosis. Okay, so it's opposite, so the potassium comes out, so the potassium leave the cell, so that create hyperkalemia. Okay, all right, and then so always watch for electrolytes. Okay, and then the patient can have seizures also in severe cases. When it comes to respiratory, same hypoventilation with hypoxia. Okay, because the lungs are unable to compensate when there is a respiratory problem. Okay, all right, so these are some of the symptoms that you should monitor for your patient. Okay, and then the last one is the interventions. So if you see that the patient is in respiratory distress, okay, always administer oxygen. You can even use high amount of oxygen by using, like nasal cannula or high flow nasal cannula, or the venti mask, non-rebreather mask, even BiPAP. Okay, and then even if there is acute distress, you can always consider intubation. Okay, and then make the patient comfortable in a semi-fowler's or a upright or sitting position. If there is lot of secretions, encourage them to cough and deep breathe, and always administer respiratory treatments to help them to excrete the secretions from the lungs. Okay, and then if the patient cannot do the cough and deep breath, try to suction the airway. Okay, and also you can encourage the hydration, if not contraindicated, to thin the secretions um, that will facilitate the removal of secretions. Okay, and most of the time, if there is any respiratory distress, the patients will be restless. Okay, always reduce the restlessness by improving the ventilation, but never ever administer any tranquilizers or sedatives or opioids. Okay, because this can further suppress the respirations and it can complicate the condition. Okay, all right, and then monitor electrolyte, especially potassium, because there can be chances of hyperkalemia that can lead to dysarrhythmias. Okay, and if there is any infection, administer antibiotics. Okay, so these are some of the interventions that you can do for the patients with respiratory acidosis. I hope you all understand. Thank you for watching, and watch for my other videos. Thank you.